Let's start with something we don't say out loud enough. Women's healthcare is still catching up to women's actual bodies. Younger generations of women are dealing with issues we thought were settled: restricted access to reproductive care, ongoing stigma about sexual health, and a medical system that still too often dismisses women's pain, symptoms, and actual lived experiences. And it pisses me off. As a mom of two daughters, it's infuriating that they are still dealing with things that I dealt with and my mom dealt with. I mean, there has been progress. We got the black box warnings on hormone replacement therapy removed, and we're seeing some more research on cancers and conditions that are specific to women. But really, let's step back. It's pretty clear the system is still not designed with women fully in mind. And one of the biggest gaps? Pleasure. Women are rarely taught to understand their own bodies beyond reproduction or dysfunction. We're taught how to prevent pregnancy, how to manage symptoms, and the best, how to fix our problems, but not how to actually know or understand or experience our bodies in a way that includes pleasure as a normal, healthy, and necessary part of our care. So we grow up with mixed messages, and today's generations of younger women are no different. We're told to be in control of our body, but don't explore it too much. Advocate for your health, but don't be difficult. Be confident, but stay within the lines. But what if knowing your body fully, honestly, and without shame is the foundation to everything as a woman? What if being able to communicate that knowledge, to advocate for yourself in all areas of life, and even to teach your partner what your body needs and what you want is part of what real healthcare should include? My guest today, Terri Vanderlinde, has spent her career helping women do exactly that. And I will be transparent. I can tell you this from personal experience because Dr. V was my gynecologist for a very long time. She taught me to advocate for myself because she advocated for me in times when insurance and healthcare wanted to shut me down. And she considers all aspects of a woman's experience, not just physical, but mental, emotional, and yes, sexual. Today, she works with women to build real body literacy, to reconnect with their own physiology, and to see pleasure not as an afterthought, but as an integral part of their health and well-being. Novel idea. This conversation is about reclaiming knowledge of your own body, how it works, what it needs, and what it's capable of. Because honestly, when women understand their bodies, everything changes. How they advocate, how they make decisions, and how they define what health actually means for themselves. Dr. V, I'm so glad you're here.
Oh, Dr. Buckley, I'm so happy to be here. I'm real. Thank you for doing this. Thank you for this opportunity. And it's really nice to know that women are not alone. Back, way back, women would get together in sewing circles and in
Yes.
cooking circles, and that we would support each other and talk to each other. And the generations would be there. So you'd learn what the older generations and middle and younger generations would have to say.
Yeah. Yeah, and I love that you said all that because that's exactly some of my thought process on this platform is when we think about sitting around the campfires and the women being the storytellers and the wisdom keepers, which was done in the past but is still done in some cultures around the world. When we think about the sewing circles or the backroom kitchen or whatever it might be, that's what is important. And we've lost a lot of that. We've lost the opportunity to just have those frank, honest conversations, particularly sharing that intergenerational wisdom. So I'm
Absolutely.
curious, in your experience, just to start off, when you do talk with younger women, and certainly women in general, when you're talking about bodies and relationships and desires, what's the thing you hear most often?
Every age I hear, "I have no desire." And it can be from younger women who are afraid of getting pregnant or STDs,
Hmm.
to women who are having pain when they're older. But when I was just listening to my patients, a majority of them every single day would come in, "I have no desire, I have no desire, I have no desire." And I felt completely inadequate in being able to answer the questions. So I went and did a fellowship and became a certified sexual counselor, which is
That's
different
awesome.
than a therapist, because a therapist has a PhD in therapy, and then they take this extra fellowship training in sexuality. As a gynecologist or as a medical practitioner, I take those same sexuality courses. I have the same sort of supervisory role. And then I felt after 2 years of study and mentorship that I could answer women's questions honestly, effectively, and really get at the root of the things, because a majority of the time, it had nothing to do with sex. A
Right.
majority of the time, it had something to do with pain, with prior trauma. But the most reason that I found that everybody had less desire, lifestyle problems. They're too damn busy. Busy, busy,
Oh,
busy, busy, busy.
yeah.
There's so much going on in their heads, taking care of kids, taking care of themselves, taking and going to work and trying to just like keep all those plates spinning all at the same time. That is what I find. So, one of my favorite questions to ask is, if you and your partner went away on a vacation to a deserted island and had all the food and everything you wanted, it was just perfect, would you be looking forward to having sex? And if they say yes, it's like, fine, you don't have a sexual problem. You have a
Right.
lifestyle problem.
Oh, I love
If they
that.
say no, then okay, let's figure this out. Is it a
Different
relationship
conversation.
issue? Yeah, right, exactly. So I think that the important thing is that if doctors or providers could ask their female patients, um, how's their sex life? How's their desire? How's their
Mhm.
pleasure? I mean, I asked everybody, are they urinary leaking? Why not talk about everything possible in
Right.
an informed way to be able to help them? So I was just feeling so frustrated that I didn't have the answers. So I went and learned how to give the answers.
Why do you think that women are hesitant or shy or embarrassed to talk about pleasure and the things that their desire, but they'll come into a provider like you and talk about, well, this hurts or I felt this lump. They're very candid about that. But their pleasure and their health in that regards is something that they still shy away from,
Yeah, nobody brings it up really unless they feel like that there is a problem.
that they're
Um,
broken. Yeah.
Yeah, because sometimes they don't even know. Sometimes it is a relationship issue. Sometimes it's a trauma issue. There's lots of different reasons, but most of the time, like I said, I find it to be a lifestyle issue. We're too busy. We got too many cell phone things going on all the time. We're driving kids all around to different places. I had to make myself a personal decision that during those years when my kids were young and I was working 120 hours a week in the military and stuff like that, I had to decide that this was not the time for me. This was the time that I needed to just work and work and work and take care of kids. And so those were the times that I kind of let my body go.
Hmm.
And when I gained more weight, I didn't feel as sexual, didn't feel as comfortable. As a personal issue, my body was something that would keep me from wanting to be intimate.
Mm. So the idea of putting yourself to the side for those years, would you do that again in retrospect?
That is a really good question. Um, it was one of those things that whenever I was home, I felt like I should
Hmm.
be at work. And whenever I was
Mm.
at work, I felt like I should be at home. And so I never felt successful in any arena of my life.
Oh, yeah.
So would I do it again the same way? Yeah, I think I would. Being an
Why?
OB-GYN was my passion from even before I went into medical school. I was a high school teacher of sciences at an all Catholic girls' school in
Oh,
Providence,
I
Rhode
didn't know the Catholic all girls school part.
Mhm. And so I taught computer science and biology and an advanced course in anatomy and physiology. And I also volunteered at Planned Parenthood at the exact same time. And my
Oh,
principal, we had the church
yeah.
right next door to the school. Principal said, I don't want to know about it. Whatever, but this is what I'm doing. The girls would give me urine samples and I would take them in and see if they were pregnant.
Wow.
Yeah. And yeah, so again, it was because of a lack of knowledge that I had as a high school science teacher. And all these girls were coming to me with, I think I'm pregnant. I got raped last night. I can't tell my parents. So I was sort of like the underground in the Catholic school
Yeah,
to get them health
that's
care.
great.
And so that was basically, I need to know more. I need to know more. I need to do more. I want to learn more. I want to teach more. That was the reason I went to medical school in the whole first place, was to be an information provider to women so they
Mhm.
could make their own best decisions for themselves.
So I appreciate what you're saying, that we have to have balance in life and everything
Hmm.
is gonna be equally balanced is just bullshit. Absolute bullshit, and I try and explain that to my clients and women that I know. But
Yeah.
how do you again, I appreciate your answer that you still would have done it the same way. Is there a way to still take care of ourselves as women and still do the things we wanna do in terms of our careers or being a parent? Or I struggle with the idea that we make the choice that we are not gonna be part of the equation. So I'm just wondering, if you were talking with one of your patients or one of the amazing women you work with in Ghana, how would you help them maybe rectify that they don't always have to be overlooked?
Overlooked with their intimate partner, or overlooked in the medical
Overlooked
care?
the doing the overlooking themselves, like, "Oh, I don't need to take care of myself," or, "I don't have time to take care of myself. I wanna focus on, my career and my kids," which are certainly wonderful goals. But I wish there was a mental shift that you can have it all, maybe not all at the same time, but waiting 10, 20 years to take care of yourself might be a disservice to yourself as a woman.
Yes, I agree. And should I have had more balance? Absolutely. But I'm retired now and I'm making up for all kinds of lost time. And I did have balance somewhat, but it was just basically get through the day. Get
Mhm,
through the day. Get through the day. And I would let my patients off the hook. They would say, busy with this and busy with this and busy with this and busy with this. Like, okay, if that's your focus, let that be your focus. Don't keep beating yourself up. If you're choosing to focus on this, focus on it and recognize something else is going to have to slide. Mind, body, spirit.
mhm.
I mean, everything needs to be in balance. But I think we've taught our children way better than we did. When medical school way back when was 120 hours, just, constant, up all night, many, many nights a week, just constantly sleep deprived. It was really, really rough back then. And that was just part of it, sort of in the military too. It was just what you're supposed to do. So we just did it. But we taught our children much better. So don't make this mistake. Don't have a career that is so overwhelming that you can't do the things that you want to do, family, et cetera, and vacations and whatnot. And my kids are showing that. And sometimes I feel jealous because
I
they have
agree.
that balance that I wasn't able to achieve at their age. I'm like, damn it, they should work harder first. But no, they've got it right. We taught them well. It's not gonna be forever, and so my daughter's great, she quit her job so that she can work on her own job of matching up nannies with parents who need nannies, so that was her own company, so she quit her regular job, and she's also raising 2 kids fabulously, and she loves spending time, and so to see her being able to succeed and see where her priorities are
I gotta tell you,
fabulous.
Terry, that I so agree with you because it's easy to hear from, you know, older generations, "Oh my god, these kids have no work ethic, and they don't work hard, and they don't know what it's like to work hard." And I am in full agreement with you, about, and especially about the jealousy. I look at, my kids, my niece and nephew, and they are not doing it the way that our generations did. They are really redefining what work ethic means. It means, yeah, certainly you can do a good job, but your good job doesn't mean you sacrifice everything else. My niece is a great example. She is 24 today and has been working since she graduated college a couple years ago. But her PTO, I don't even know if it's defined. Like, she's gone on 3 huge trips in 1 year. And, I've heard some of our older relatives like, "Does that kid ever work?" I'm like, "She does work, but she found a job that she can take the vacation time, and then she can make up the hours as she sees fit, whether that's a Saturday or whatever." But and I am jealous. I'm like, "That is so cool."
Yeah.
And I'm curious that within this idea of balance and time, if you did, how did you make time for your relationship and intimacy or sex in your relationship during those years when you were really dedicated to your career and your kids?
My husband and I joke that we were on the quarterly plan during those times. So if we had sex 3 or 4 times a year, once every couple months, it was always good when it was there, but it just wasn't there that often, and we basically just said, "I d we're allowing this to happen, we're aware that it's happening, but we're just too damn tired to be able to do anything about it, and we didn't see any way around it." He's working as an ER. I'm working in the OB-GYN. I have to say, though, we kinda cheated. We had a live-in nanny because we were both coming and going all the time, so we had to have a 3rd adult in the house if ever the 2 of us weren't there.
Mhm.
So, we had a fabulous way of knowing our kids were always safe, whether it was us or somebody else with them, we knew they were always safe and well occupied. That was our answer to knowing the kids were good because I had no choice. I get called
Right,
in for delivery if I have an emergency surgery. There is no choice. My
right.
son still talks about he remembers having to sit in the waiting room of the operating room of York Hospital multiple times because I had to pick him up from school and bring him back so I could finish my surgeries that day.
Yeah,
Somehow you figure it out each day.
and it's
And no, there wasn't much balance, but we tried. We tried. We tried to do all sorts of family things together. We tried to take family vacations together. But family vacations, as you know, with kids are not a vacation. They're a
no, my husband
parent's
described it as parenting
training.
somewhere else.
Yeah, 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 exactly. So we were stressed, maximally
Yeah,
stressed, and
yeah.
didn't even really know. It was like, oh, okay, we're in it, and we just got to do it. So we just did it.
But one thing I heard you say that I think is important to point out is you outsourced. You asked for help or hired help instead
Yeah.
of going with the societal belief, particularly for women, that nope, this is your responsibility. You're a mom. You're supposed to be doing all this. And if you give it over or give some of that responsibility or task to someone else, somehow you're lesser.
Yep.
And
The
that
guilt
is
is there.
important. Yeah. Well, yeah, certainly the guilt is there. And that I would love to find the magic pill for because why when women make the choices to do things that are not only good for their kids, you had someone reliable that was, a consistent person in their lives when you couldn't always be there, but it was also good for you, which means it's good for everybody. But yeah, that guilt comes into play. And I would imagine in your field, guilt undermines when there is time for sex and intimacy. Guilt just weighs on people to be an obstacle.
And fatigue and overwhelmingness of everything in the life that, just being an adult is hard enough as it is.
You said a couple minutes ago, and I don't want to forget this because it's important and something that I want younger women especially to hear. You said intimacy and sex are different. And I think this is one of the biggest misconceptions out there because people hear intimacy and they automatically think of sex. How would you define those two concepts?
That's a really loaded question. Because how do you define, no, seriously, how do you define sex? Is it intercourse? For some people, that is their definition. For most men, that is their definition. For women, it's more of define sex as communication and connection and physicality and touching and massaging and appreciating and more of a emotional endeavor, more of a multi-layered connection. So we don't fault men for being who they are and what they are. That is men, and we need to just and I'm speaking on a heteronormative level. But when I talk to all these couples, for men it is about touch, about touching their penis, and about having intercourse. And so we spend a lot of time just trying to expand that definition and to be able to have both parties get what they want because gross generalization. The women usually say, I want more connection, I want more touching, I want more kissing, but I don't want to even want to kiss him because if I kiss him, that means we're going to have sex and I don't want to have
Right.
sex. I said,
Right.
okay, well, what if you just spent some time making out like teenagers? What if you just made out, like had dry sex with your clothes on? Pretend, just go back to the beginning of your relationship. What were you doing then? How were you touching? How were you petting? What was exciting for you? Here's the thing for couples that have been together for a while. What haven't you done? What
Yes.
interesting things are you willing to consider? And I absolutely always bring up vibrators. Absolutely, absolutely.
As do
And,
I.
seriously, in medical school, we never learned about the clitoris.
I know.
We
That's
never
insane to me.
learned about pleasure, relationships. We learned all about the medical stuff, but never about the emotional, our patient, our person who's in front of us there, who so desperately wants our help. And if we're not trained, I think we do them a disservice. And who else but an OB-GYN is somebody going to open up to like that? Or,
Right.
or therapist?
Ye I'm really curious. Do you see, a change for younger generations of women in the understanding regarding pleasure and specifically their clitoris? Or is it similar to older generations?
I didn't even know about vibrators until I was in my 30s, maybe 40s. My daughter's 17, goes off to college. She has her birthday and she posted all these pictures on Facebook and they've all given her vibrators, all their friends. I'm thinking, what are you doing
Those are
posting
good
on Facebook?
friends.
And then I'm like, wait a minute, change hats. Good for you. Good for them. And I do find the younger women that I speak to in my practice were way, way more comfortable with masturbation, way more
Awesome.
comfortable with vibrators, finding one that they liked instead of just saying, oh, well, this one didn't work. I guess they don't. So, really being able to say, yeah, I want to be a sexual being. And yeah, I'm okay with that. So I do think our younger women are much more empowered, but it's
Love
it's
it.
always still taboo. Everybody's still embarrassed to talk about it.
There has been a regression in some areas of women's ownership of their bodies,
Yes,
voices over their bodies, which
absolutely.
again affects their reproductive and sexual choices. And I think it's fair to say, at least from a legal perspective, is dictated by men because
Yes,
men are in the positions of political power.
yes.
So I'm curious if there's anything that we could learn from your experiences in Ghana working within patriarchal societies that start to move the needle forward with progress. Because I honestly look around and there are times when one or both of my daughters are in tears because they're just like, Mom, what is going on? And I don't even know where to start to make a difference.
Little bit by little bit by little bit,
Mm,
consistency, trust, relationships, giving
I love that.
information, giving knowledge. That's the power to make their own changes because you can't make changes for anybody. You can give
Right.
them information and hope that over time, a message is getting through
Right. So education, letting people have their knowledge, letting them make decisions that make sense for them,
with
but
them.
particularly asking the questions of women to say, is this okay? Is this something that you really support or is it something you've been taught? Is there something that you see missing in the conversations around pleasure or women's health in general that maybe younger generations could pay attention to start to implement in their lives?
Intimacy and pleasure is within, but it's also from without. It's also with your partner. And
Mhm.
if you have a partner that you don't feel comfortable saying that feels good, that doesn't, or if you say that doesn't and they take it personally, like they're a bad lover, they're not going to touch you at all because every time they touch you is something wrong, as opposed to being able to just say, that feels good, that doesn't feel good, without making a judgment about how somebody is as a lover. And so I would have them do exercises. They would give each other massages. So I would say, find 5 ways to massage the head. Okay, this way. And then ask your partner, do they like it or not? Would they prefer it harder? Would they prefer it softer? Would they prefer it with fingernails? Would they prefer it with a little pull? Whatever. But you start the conversation about things that are not about sex.
That's
It's
great.
like you can like broccoli or you can hate broccoli. Who cares? If you like it soft, if you like it hard, who cares? But if you are able to enter into that non judgmental, conversation of you're not doing it right. You don't know what you're doing. But we really have to teach our lovers what feels good to us. And for us to do that, we have to know what feels good to us.
Agreed.
So we need to have our
Agreed.
own body awareness, our own sense of personhood to be able to feel confident enough to say, "Oh, I really like that." Or ask even a partner. My husband and I have been married close to 35 years, and it's still, "Do you want that? Do you like that? Sh and would you do that for me?" That, I think, is being able to take it out of the, "Oh, I'm bad at this," to,
Yeah.
"Oh, how interesting. You like that, but not that? Okay." And if they don't remember, you can't. When I was in training, one of my other colleagues used to say that men are like puppies. You had to just keep teaching them and teaching them and teaching them and reminding them and reminding them. And
Yeah.
in some ways, she's right. Um,
Agreed. And
yeah.
I've also seen, and going through my own perimenopause journey that you were such an integral part of, it's also important for women to understand that your body is going to change. And some of the things that for maybe even decades have felt good, all of a sudden don't feel good. And it's not a criticism to say, "Hey, that's not working anymore. We've given it a couple tries and that's just not it." And then finding the next step, but having a drawer full of tools, sexual wellness devices, vibrators, dildos, whatever it might be, it's just part of that exploration of curiosity, which
Yes.
if we approach it, and something that you've alluded to in our work together, if you approach it with sense of let's find out,
Yes.
it allows it not to be a critical or shameful experience. And maybe it reveals something that's great, and maybe it reveals something that you're gonna table, but it can just be part of that process.
Exactly. Yes.
I love that. One other thing that I've found, and I know it's not your specific area, although you do work with a lot of couples, is I've also found that when women are able to do that and adapt to changes, whenever that might be, whether it's when they're pregnant or after childbirth or later on with menopause, it also allows their partners, and in this case, we're talking heteronormative, but a male partner to be accepting of their own changes, because men go through changes as well, whether it's, more difficulty maintaining erections or not having an erection, and letting that be an okay part of the process. Like, okay, let's figure this out. Let's explore this. It again isn't some kind of rejection of who you are as a lover or as a man. Let's figure this out together rather than it's all on you. And if women embrace that, that's certainly something that they can help men when sometimes that is so much a part of their identity.
Yeah, I can't tell you the number of times men would send in their wives to get hormones because they lost their desire, or how many times men would send in their partners to just say, well, they don't want to have sex anymore. My question is, why don't they want to have sex with you anymore?
Oh, good
What are
question.
you doing for her that makes her like you? Did you do the dishes? Did you help put the kids in a bath? Did you let her have free time to go and get her nails done? Did you vacuum the carpet? Did you do something to make her life easier? Guess
Right.
what? That's foreplay.
It
That's
is.
that is showing you care. That is showing that you're willing to put in effort. And I've had men say, "That's all it takes is do the dishes," and his wife will be in the room. Yes, that's all it takes. He goes, "Well, I'm not doing that." Like, then you're not getting sex. I mean, seriously, she just
Right,
told
and
you
I've
the
heard
key,
so many
and you're not
men
willing
get
to do it.
yeah. I heard so many men get defensive like, "Oh, so it's quid pro quo?" And I'm like, "It's not quid pro quo. It is you are making space that she's not going to be as tired, as distracted, as overwhelmed, potentially as resentful. You are eliminating all of that. So now there is time and energy left over for the 2 of you. This is not a trade-off. It is finding a workaround so that you keep that space sacred and it isn't infiltrated by, a woman after this is over, I gotta still have dishes to do and I'm exhausted.
Yeah,
So it's changing that mindset that it's a gift to the 2 of you.
exactly. And I would remind people that they're a team, and a team requires all participants of that team to be doing their part and putting in their effort and doing their practice and whatever. Because if you think about it, she doesn't want to have sex with me. He pushes me to have sex all the time. Then it's
Yeah.
the two of them against each other instead of
Right.
realizing they're the they're the team. They can help each other, and they can help each other help things extraneous to their sexual relationship that can improve their sexual relationship.
Agreed.
So I want
And
women to hear that it's not their fault. I want women to hear that whatever they feel is right for their body, that's right for their body. And don't let anybody ever tell you anything different. Advocate for yourself. And unfortunately, this country is going backwards and backwards and backwards. Honestly, that's a major reason why I retired, is that I could not be part of that system. Even though I
yeah.
fought against it for all 30 plus years that I was a doctor and did what was right for women anyway. I couldn't fight
Yeah.
anymore.
It's
They're taking away
infuriating, and I
medications.
try and focus very hard on the stories of people out there who are pushing, mostly women who are pushing and encouraging and not giving up, but it's tiring when
Yes.
things that were just a
Yes.
given are all of a sudden gone. But I do believe, as you've said over and over, it is women, when women say, well, what more can we do? Be educated. Don't stop pushing. Don't stop advocating. Putting yourself as a priority, whether it's with health or with pleasure or your own life, making decisions that work for you rather than going along with what society is telling you is the way you have to be.
Exactly. Exactly.
Do you mind if I ask you some just rapid fire questions that I ask
Go
all my
for it.
guests?
Sure.
What's your go-to Power Woman song?
You may not know it, you may not be old enough. Helen Reddy's I Am Woman.
I, of course, know that song. Absolutely. I
I'm
love it.
woman, you roar. I'm too big
Great
to
song.
ignore. Yes, I am wise, but it's wisdom for the pain. Yes, I've paid the price, but I'm getting goosebumps. But look how much I've gained.
I
Yeah.
know. It's perfect. What's one life hack or tip that you regularly use?
Find the laughter.
Mm,
Look for the laughter. Create the laughter. I spent much of my kids' growing up time not laughing because I felt like I had to hold it together so that they could hold it together. And that meant that I had to be the parent, and I lost out on so much. Just look for the laughter, look for ways to create laughter, enjoy all the time that you possibly can. Be mindful of
mm.
what you're doing when you're doing it. When you're with your kids, be with your kids. It is quality and its intention, and you can make it okay.
What's one of your favorite books?
I was one of those nerd kids. I read Lord of the Rings way back when in high school. That was really one of my favorite. I mean, if you think it was about World War II.
Yeah.
And it
Yes.
had so many political things and so many life lessons in
Yes.
there.
Agreed. What's one belief you had to unlearn?
Men know what they're doing. No, men don't. We really have to teach them. And it was funny. My husband and I have these hypothetical conversations sometimes. We are nudists and we go to nudist parks and people think, oh, well, nudist is swinging. No, this is just my
So
relationship with the
not.
sun.
Mm-mm.
It had nothing to do with you. But we had to have a lot of conversations around that. Yeah, that they really don't know what they're doing. But in this hypothetical thing, I was talking with my husband. I said, well, if we ever exchange partners, I have it easy. Men are just like, touch it, touch it. And I said, and you're going to have to learn a whole other combination puzzle box of a person that you know nothing about. And he's like, oh, yeah. I said, well, I've been 34 years teaching you what's right for me, but that's not going to be right for the next one.
Again, one of the things I love about my husband is the self-awareness, and he will describe men's penises as blunt instruments. He's like, Robin, there's no finesse to them. He's like,
Yeah.
it's pretty much you
Yeah.
touch it, you're going to get a reaction unless there's something off. I'm like, good to know. Okay.
Yeah. But that's okay. Men can
Yep.
be physical, men can
Yep.
be visual. That's
Yep.
what they are. Accept it, understand it, work within it. So
Exactly.
wear something a little sexy that you
Right.
feel comfortable with, so you have to feel comfortable first, and then
Absolutely.
you can teach him.
And with knowing that about men, you don't have to accept that as that's what's right for us then.
Yeah.
Okay.
Yeah, they really do, because their education is from pornography, and
Yes.
it's violent. No, women really don't like this. No, women really can't have an orgasm with just. No, it really doesn't happen that way. So just unlearning the entertainment industry for reality of a real
Right.
person and a real woman. Um, Huge.
Agreed. What's something you do to take care of yourself every day?
I brush and floss every day. That seriously, that's huge for heart disease. That's a
It
big
is.
deal. And right now, since I'm retired, I go to the gym almost every day. And those are things that, hey, if I'm going to be a healthy 80-year-old, I have to be a healthy 60-year-old.
That is something a previous guest mentioned that you start ideally as soon as you realize it. So your 20s, 30s, 40s, whatever age it is, to start preparing for your future healthy self.
Yes.
Yep.
You do what you can.
Yeah.
And you have to give yourself a break. You can't do everything. You can't do everything right. You can't do everything perfectly. You have to just accept your limitations. It
Agreed.
took me until my 50s to say, good enough is
Yes.
good enough.
Yes. And then last question, what is something exciting you're looking forward to?
Going to a nudist resort next month.
Do you have a favorite?
Well, we go to one in Florida that is called Caliente, and they have dance nights, and some of the nights are like theme dances, and one of the dances this time is going to be anything but clothes. So we're going with fig leaves. So again, we're not taking ourselves seriously, and we're
Yeah.
just having fun, but we would not have been able to do that younger in our lives. It would not have been okay
Yeah.
in our professional and with our kids and everything else. So there's time. There's time to have fun. There's time to have pleasure.
Yeah.
Just
Yeah.
be
And
okay with
I will
when
tell
that.
you, my limited experience with nudist beaches is that it really gets you outside of that built-in focus of outward appearance because it's just everybody's there with their bodies and it doesn't matter what the body looks like. And
And their scars and their
yes,
weight and
and I
everything. Yeah.
love that.
Yeah. Because a lot of times we interpret stuff about people by the clothes they're wearing. They're not wearing any clothes. No preconceived notions. It's just
Yeah.
you looking in the eyes of another person and having a conversation.
Agreed.
It's really a whole community into itself,
It's
where we're
very
just really
different than
fun.
I think most people again, I agree. I think most people think of it from a sexual level, and it is,
So
again, in my experience, sometimes one of the least sexual
yeah, nudity
environments.
people equate automatically with sexuality because they don't know any other times that they can be nude that isn't sex.
Right, right. I love that.
I love being nude.
Well, let me know when you're going, and maybe I'll meet up with you there. I know where Caliente is, so oh my gosh, Terry, I cannot thank you enough. This has been so fun, and it's always just brings so much joy to me to see you and talk with you, and so I appreciate everything that you offered and your vulnerability and your candidness, everything, especially to the women who are building their lives and this future world of ours. I'm gonna make sure to add in details into the show notes regarding the work that you've done, and certainly to all of you, take what you heard today, carry what matters, and pass the wisdom forward because when women speak, the world changes. Thanks for listening and see you next time on That's What She Said. Follow That's What She Said on social media on Instagram, TikTok, and YouTube. That's What She Said is created, hosted, and executive produced by Dr. Robin Buckley. Our Senior VP of Productions and Content Strategy Consultant is Dr. Tom Grabowski. Jordan Gilbert is our show's Marketing and Creative Content Specialist. Senior Producer is Quentin Sukup. And remember to keep the conversation going. Subscribe wherever you get your podcasts, whether you're a woman who's lived it or a woman who's building it.